Yeah, so 5 years ago, I left my career as a medical device vendor at Zimmer Biomet because I felt that the way in which the hospital was sharing the surgical schedule with device vendors like myself was really time consuming for the hospital, but I also felt like it put patients at risk. It really wasn't adequate and had a lot of room for error. And so now TORQ is live in a lot of the major Harvard teaching hospitals and academic hospitals in downtown Boston and beyond. So I'm going to back up a step and tell anyone that doesn't know on this call what a device vendor does inside a hospital. They're actually critical. They're in 38% of all US procedures, but if your day-to-day is not in the operating room, you might not be as familiar with those vendors. But they need to know about every surgery that involves their implant so that they can make sure that those implants and instruments are available for surgery. So if vendors are unaware of a particular case, that case is likely to be delayed, canceled, or a surgeon might opt for a plan B mid-procedure, which obviously is not optimal for a patient and then slows everything down. So what I left my career for was I in every hospital, there's something that looks like this. So someone within your hospital is printing out the surgical schedule. Typically they'll do it about 3 times a day, and then they'll highlight. Sometimes they highlight and sometimes they just look at it. But this one is an example at a big academic hospital, and they're printing the schedule out, highlighting every case depending on every color is a different vendor. And then they email, call, and text those vendors, letting them know what cases they have assigned so that those vendors can then bring in the proper equipment. And then sometimes they themselves are in the OR assisting those surgeries. This is obviously really not time efficient, and it also leaves a tremendous amount of room for error. As you can imagine, the surgical schedule is incredibly fluid, or as you know, the surgical schedule is incredibly fluid, and trying to keep vendors updated with this constantly changing schedule is impossible. So what happens is vendors will call multiple times a day. The OR staff will try and preemptively call them, and it's just this back and forth process that is very disruptive to care, and it's kind of pulled together in any which way. So what TORQ does is we pull the surgical schedule directly from the electronic health record, so Epic, Cerner, Meditech, or whatever you use, and then we push the relevant information to the device vendors in real time through the TORQ app. So vendors do not see anything differently than what they currently see today, but rather they're just seeing the surgical schedule that they were receiving via email or text or phone call now in an automated, streamlined fashion. There's no PHI that's required to go to vendors. It doesn't go to them today, and it doesn't go to them via the TORQ app. So this is what it looks like. On the far left or right, I guess on the far side, you can see the list view. Vendors can see all of their respective cases. This is really important as they try and juggle multiple hospitals. You want to make sure that they're prioritizing your hospital. So if you have a case, that vendor needs to know about exactly what was ordered. So on the far right, you can see the special needs. That's exactly what the surgeon requested. Again, this is happening all day, every day, where vendors are learning about their cases and exactly what that surgeon requested, either through a phone call by the surgeon, from a charge nurse, from the OR director, from the materials department, often from everyone. It's just this kind of chaotic mess that everybody's learned to live with because Epic, Meditech, Cerner really didn't account for vendors, which is interesting. So this now is just the device vendor can see exactly what's happening, exactly what was ordered, and make sure that the surgeon has what he or she needs prior to that surgery beginning. If the hospital wants to see what the rep is seeing, they can log into their own version of TORQ, either through the app, or we also have a web-based version. And they can see on this first phone, you can see all the device companies that have confirmed their cases. So it turns green once they confirm that they will make sure that the hospital has the proper product and that they've seen that case, and they will typically cover that case themselves. And then you'll see the individual name inside here. If a hospital member wants to add a rep, they can do that. But all of these vendors are being added to the cases through an automated rules engine. So if a surgeon has a arthroplasty total hip and they request a persona knee, it's automatically going to pair to the Zimmer Biomet Recon rep. All of your nurses know all of this information in their heads and are reaching out based off of what they know, which is going to be tricky when I think nurses are being pulled in different directions in the roles that they're usually playing. But anyway, the reps will confirm. They get tied to the cases based on whatever is in the notes, whatever is the surgeon preference. And then if anyone needs to call, text, or email that vendor, they can do that right from the app. So it's just a streamlined approach. So right now, I think everyone's dealing with COVID-19. There's an extreme strain on supply chain and those who typically order product. The current process that's in place, again, as I said, it's already really messy, and that's why TORQ was created, was to handle it. But all the nurses that are currently overwhelmed with dealing with other challenges are certainly not going to be able to be printing that schedule out, looking through it, making sure that the vendors know what they need. Vendors are very proactive, and they try and look into the cases and see what is their business, so that, you know, if a surgeon's planning to use, let's say, Zimmer, and there's no Zimmer product on the shelf, then they might opt to use Stryker that they're less comfortable with. But that's what lives inside the hospital. It's not ideal for the hospital, but it's also not ideal for the vendor. So the vendor will, and often there's no substitute. So it can be very chaotic. It just depends on the situation. But right now, vendors are not allowed in a lot of hospitals. And so all the fail safes that have existed are gone. And so that's scary for patients that are getting surgery today, when people have been allocated, and this manual process, we're relying on nurses and materials and vendors to notice and catch where equipment needs to be brought in, is really increasing our chance for a problem. So I think allowing vendors to monitor the surgical schedule, and vendors are really a part of the surgical team to begin with, they're just outside, but allowing them to monitor it and help you, I think, is going to be critical to not allowing COVID-19 to take over and create subsequent effects, which we're certainly going to see, which launches me into my next slide. And that's after we get through this kind of pandemic where we've shut everything down. I'm in Boston, so we definitely have shut things down here. And there's going to be a backlog when we turn elective procedures back on. And it's going to be, as I said, and Devin had talked about, it's going to be critical that hospitals maximize OR time. There's going to be cases on Saturdays and Sundays. And hospitals are going to be rescheduling. It's just, again, it's not going to be business as usual for a long, long time. And device vendors are also going to be dealing with a higher volume than they've ever dealt with. So giving them as much lead time so that they can make sure they provide the adequate equipment and service for surgery is going to be crucial. And giving them the information they need in order to do that is going to help with that. So TORQ is really saving staff time, but more importantly, preventing mistakes that are already occurring today, but I think are going to occur in are just going to continue to grow upon themselves. So TORQ is actually a free system for the hospital, not just through July, but it's actually free forever because we charge the device companies. We're creating so much cost savings from them. That's my background. And right now they're struggling with last minute add-on cases that are booked with 3 days or less is how they define them, shipping in way more product than is necessary. And I could go on, but if you're interested, we can discuss that. We also don't change any workflow. So the current TORQ solution is just simply automating a very manual, messy process. It's taking what's in somebody's head and just wrapping technology around it to clean it up and streamline it. We also are something that reps love, which I think is always a concern. If reps don't like something, they're not going to use it. But this is just, reps will say it's the first thing they look at in the morning and the last thing they look at night, because there's a lot of angst. If a surgeon has a surgery and you don't know about it, there's nothing more stressful than explaining to that surgeon why they didn't have what they needed. And So reps really love being inside that loop of communication, but they can only see their respective cases, which is why a nurse can't just share an Epic schedule with them, because they would see way too much. And that's what TORQ does, is we limit it. And then lastly, we're very IT department friendly, so it's a light lift from that perspective. We don't share any PHI or unidirectional, and obviously we work with Redox. So to date, we've kind of virally grown and just spread into hospitals based on word of mouth. I think we're a very simple solution to a real problem that really is known by everyone that works in the OR and device vendors. And I think just a clean solution to something that can prevent a lot of errors. And I'll leave it there.